Is it going? Okay, make sure you don't put your fingers in front of the... Okay. Hi, Dr. Kennedy, because I assume you're going to be the only one watching this. I'm not really savvy with laptops or... Don't laugh at me. Or setting up anything like that, so I don't know how to record myself on that, but I do have an HDMI cord. So, I'm going to use that to do my presentation. So, I decided to do my presentation on the motor neuron disease known as ALS, or amyotrophic lateral sclerosis. Kind of a mouthful. But about the disease, what it is, it's a neurodegenerative disease that affects the nerve cells in the brain and the spinal cord. So it pretty much affects your entire central nervous system. The disease is either known as motor neuron disease or Lou Gehrig's disease because Lou Gehrig was the first person it was diagnosed in. It causes the nerve cells to be more torn apart from one another and more narrow, and it causes a lot of loss of a person's muscle control. And here are just some pictures of famous people who have ALS or who had ALS. We have Stephen Hawking, who was a very famous scientist, and then Steven Hilberg, who is the creator of SpongeBob, one of my personal faves, and then Lou Gehrig, who was actually the first person to get diagnosed with the disease. So here is a picture. You want to get closer to show them? This is a normal spinal neuron. So you can see here's the neuron, and then this is the fiber that connects to the skeletal muscle, and you can see it's healthy, everything's attached. But you can see in the diseased spinal neuron that the muscle fibers are more narrow and torn apart, like I said they would be. I'm doing a presentation. Zane's recording me. Get out. This is for a grade. Sorry about that. And you can see where it's not quite as attached to the muscle, so it causes it to be smaller and weaker because it's lost most of its structure. So, like I said earlier, ALS affects the nerve cells in the central nervous system, which control your voluntary muscle movements. So, it's really hard for people who have this disease to move around on an everyday basis because the more the disease progresses, the motor neurons deteriorate and then they die. And once the neurons die, they'll stop sending messages to the muscles completely, and then no more muscle function can occur because the structure is completely mutated. So some symptoms of ALS is difficulty walking or doing normal activities, tripping and falling down even if nothing's around, weakness in the legs and feet or ankles, and then because it not only affects your extremities, it also affects all of your muscles. So people will have slurred speech and trouble swallowing because the muscles in their neck aren't functioning properly, and they'll also experience muscle cramps. And some more symptoms are it normally begins in the hands or the feet. You start feeling weaker, and then as the disease progresses on, the nerve cells get destroyed and the muscles get progressively weaker as the neurons keep getting damaged. And symptoms can vary from patient to patient, depending on which neurons are affected first. But generally in the early stages of the disease, there is no pain detected. So if you want to get closer, this is an image of a normal brain scan, and you can see all of the lobes are intact, there's no deterioration, whereas this is a person in the later stages of ALS, and you can see right here that there is deterioration here, and on the temporal lobes. So it not only, well, obviously, so it affects your muscles, but you know, it starts for the core of all your nervous system, the brain. So there are risk factors with the disease. The first one would be heredity. There's about a 5 to 10% chance of people who have family members with ALS will get the disease. And then with a genetic factor, the human genome found similarities in genetic variation of people whose family had ALS, and it might make people more susceptible to getting the disease. And then with age, it seems as if the chances of getting the disease increase with age, and people are normally diagnosed in their mid-40s to mid-60s. And then smoking is really the only environmental factor risk that has been recorded. So the complications with this disease include breathing problems and speaking, because the muscles used to breathe and to speak are paralyzed completely. So there are machines that are used for this to help people with breathing obviously, and to communicate. Like I showed you the picture of Stephen Hawking, he used communication technology to be able to still talk with people. And then there are eating problems, malnutrition, and dehydration occur because there are damage to the muscles that control swallowing, and a feeding tube is normally placed in patients who have this problem. And then dementia is another complication that normally occurs further down as the disease progresses, and memory and decision making are completely lost.
I have a question.
The what? What's the question?
So is this like a wizard answer or something?
No, I'm doing this for a presentation. You can't ask me questions. Anyways, sorry about that. So the diagnosis for ALS is actually very difficult to diagnose, and especially early on, because it can mimic other neurological diseases and conditions. And tests such as the EMG and a nerve conduction study, MRI, and blood and urine test are done to verify if it's ALS or another disease. So with treatment, there is no treatment that will reverse the damage that ALS does to the body, but it can slow down the symptoms and prevent complications as the disease spreads. And the FDA has only approved 2 drugs for the disease, and one is called Rulitech and the other one is Radicava. And Rulitech is given orally, and it's shown to increase life expectancy from 3 to 6 months. But it does have some side effects such as dizziness, gastrointestinal conditions, and liver function changes. And with Radicava, it is given intravenously, and it reduces the decline in daily functioning, so the people are still able to walk around and do daily activities for a more extended period of time. And the side effects with this one are bruising on the body, headaches, and shortness of breath. So there still are some downfalls with it. So different therapies that you can do if you have ALS, or to at least help the symptoms, not really cure it because there is no cure for it, unfortunately. But breathing care, where devices to assist breathing throughout the day or at night are available. Physical therapy, which will address your pain, help you with walking and mobility, and it helps the patient stay a little bit more independent. And then occupational therapy helps patients be able to, again, perform everyday activities. Speech therapy is available to help you with, the muscles getting weaker. It can help your speech be more understandable. And then nutritional support, you can give the patient food that's easier to swallow for them. And then for social support, pretty justifiable. It's to provide emotional support for the person who is suffering from the disease and the family of the person. And that's it. Okay, you can quit recording.